I'm Dr. Julie Elner. You're watching Chapter 1 of my bariatric surgery seminar. Be sure and watch all 6 chapters. Just by way of introduction for those of you who might not be familiar with me, my name is Dr. Julie Elner. I trained under the grandfather of bariatric surgery at the University of Iowa, where bariatric surgery was essentially invented by Dr. Ed Mason back in the 60s. He did the world's first gastric bypass surgery, and I was lucky enough to be among the last classes that he trained before he retired in his mid-80s. I became the first female in the world to perform the laparoscopic gastric bypass, and the world's first laparoscopic gastric bypass was performed right here in San Diego, and in 1999 I joined the surgeons who invented the laparoscopic technique to do the gastric bypass. We soon became the leading training center for gastric bypass surgery, and I became one of the world's first instructors teaching other surgeons how to perform laparoscopic gastric bypass. My practice is currently solely focused on treating weight loss. I do bariatric surgery as well as other non-operative techniques and procedures to help people lose weight. Let's just talk for a few minutes about obesity. Why is there so much attention in the media toward obesity? People ask me all the time, is it really just a media trend, or do we really have more people struggling with this disease in this country? This slide demonstrates what has happened over the decades. Look at the first map up in the upper left in 1985. Most of the states in the country have less than 10% obesity, and a few of the darker states there in 1985 have greater than 10% obesity. But jump to 1995, half of our country is over 15% obesity. Jump to 2005, we have orange states popping up with greater than 25% of the population struggling with obesity, and some red states now jumping into the program with greater than 30% of our population struggling with obesity. Then in 2014, a lot of red states with greater than 30% of the population struggling with obesity. And now we have some states in the South with greater than 35% obesity. So the answer to that question is yes, we really do have a medical problem on our hands. This really isn't just a media trend. We really do have a medical problem. First, I'd like to introduce you to Tina. Tina is one of my patients from over 15 years ago. When Tina came to me, she was a realtor from Vegas, and her weight had gotten to the point where it was slowing her down socially, it was slowing her down emotionally, but it was also slowing her down at work because she couldn't show the second levels of the houses. By the end of the day, her knees couldn't carry her up the stairs to get to the upstairs bedroom. So it was affecting her work, but in a bigger sense for Tina, she felt like her body was mismatched with her brain. She felt like she wanted to do more with her life. She felt like she could offer more in her life, and her body was physically slowing her down and keeping her from accomplishing what she felt she could accomplish with her life. Well, I can tell you now, as you can see from the after picture of Tina, her body matches her personality because she's a complete diva. And within a year or two of having the surgery, she left her job as a realtor and she took to the road doing motivational speaking for women, outreach to women's groups, motivating people who are down on their luck to get it together and to build lives like she did. Then she didn't feel that that was keeping her maybe busy enough, so she threw in a traveling ministry program on top of that. And this woman travels from coast to coast constantly. She's constantly busy. She speaks to huge auditoriums. She has the confidence and the body that can actually keep up with what she wants to do with her life. So what's the cause of obesity? When we saw this trend here in the United States, finally, the people that fund research projects took notice and said, okay, we need to look into what's really causing this. And they discovered that 80% of a person's tendency to be whatever body weight they are is actually genetic. And we know those naturally skinny people that are built like string beans and they eat and eat and eat all day and they can't gain weight. That's because they're just genetically thin people. Most of my patients have become professional dieters. They're very good at nutrition. They understand exactly how food affects their body, and they eat far less than the average person in a lot of cases. But their genetic tendency is to struggle with weight, and sometimes it doesn't hit until later in life. But 80% of your tendency to be whatever body size you are is genetic. 20% of it is controllable. 20% of it is what we're doing with our lives. We have remote control clickers that we use for everything. We have more sedentary jobs. We typically don't have healthy meals like we used to. Our fat, our cholesterol, our preservatives that we have in our food. It's a far worse diet in a lot of ways than what we grew up with 30, 40, 50 years ago. Our kids are also not as active now in school when they're growing up, so they aren't getting the activity levels because they're coming home and playing with their PlayStations and playing with their clickers, so they aren't as active either. The real sad story when it comes to children becoming obese is that they're developing adult diseases that are associated with obesity. We're seeing more and more kids turn diabetic now in high school and sometimes even in junior high, and they're getting acid reflux, they're getting sleep apnea, all these things that we're going to talk about in this lecture. But it's now estimated that the children of this generation are looking like they're going to be the first generation in history with a shorter life expectancy than their parents, because obesity-related medical problems like diabetes are going to kill them. So what is the relationship between our weight and our death rate? Way back in 1999, you can see that one of the first landmark studies done here by the New England Journal of Medicine showed a direct correlation between your weight and your death rate. The higher the weight goes up, the death rate starts to skyrocket from any number of reasons, and we're going to talk about why those are. But way back in 1999, we were counting 300,000 deaths per year directly attributable to obesity. So how does it happen? People say, well, how is obesity going to kill me? It's actually the diseases that go along with morbid obesity that raises your death rate. And we call it morbid obesity because when a person gains so much weight, typically maybe 80 pounds overweight or so, that's when the death rate skyrockets. And we call it morbid obesity because it's obesity that's gotten to the point where it's causing an increased death rate. And that's why they call it morbid obesity, because it's a weight problem that ultimately is going to kill you. This is Alice. She's one of my patients from Fairbanks, Alaska. She was wonderful because she took pictures front, side, and back after her surgery. The after picture that you see here of Alice was taken a year after surgery. And of course, we have the side shots and the back shots of Alice. I love this picture that's coming up. I always tell people to save some sort of outfit or a pair of jeans or a pair of pants to give you perspective on where you came from. And here she's standing with both legs in one leg of her before surgery pants. This next picture with her coral pants on is taken a few years after surgery, and as you can see, she's kind of blinged up. She's on her way to country line dancing. And country line dancing was something that she always wanted to do. She watched her girlfriends go out and do it. And it was always something that made her feel sidelined with her weight. Her body just couldn't keep up with the kind of activity like country line dancing. And it turns out that country line dancing is really good exercise. So it's something that she continues to do all these years out. She really enjoys it. And it's fantastic exercise. And it goes to prove that you don't have to be in the gym slogging it away on the machines to get fun exercise.